रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स, अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे, डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
माल पूरा है?
हाँ सर,
मम्मी?
पूरा है।
पापा टाइम पे
है।
अपोलो से है सर।
थैंक्स। हाँ, पापा के बीपी का इशू है, so every medicine has to be on time.
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं अपनी पूरी प्रिस्क्रिप्शन की डिलीवरी सिर्फ 2 घंटे में, डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Hello, Apollo family. New age technology and modern treatments have given hope to cancer patients and their families around the world. Let's understand more about cancer and new age treatments in today's Apollo 24/7 Health Hour, where Apollo's expert oncologist Dr. Shishir Shetty is going to answer all your queries in the live interactive session. Join us 11 a.m. and ask all your questions. Also, in Apollo 24/7's Health Hour, we have a health quiz coming up where you can answer questions and win prizes. See you there, 11 a.m.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour, where we bring you Apollo's experts every Sunday to your doorstep, and we bring them live so that you can ask your questions and queries and get answers from our experts. Today we're going to talk about new age cancer treatments, and joining us shortly is Dr. Shishir Shetty, a very, very popular oncologist who's a specialist in surgical oncology. He's going to join us and answer all your queries regarding new age cancer treatments. Before we start the show, I would also like to remind you that please download Apollo 24/7 app, which brings the entire Apollo hospital to your hands, to just at a fingertip. You can find a lot of benefits like video consultations of doctors, online consultations, prescriptions, medicines, and a lot of benefits as well. Also on the show, you can win prizes and coupons. Please wait for us towards the end. We are going to share you certain coupons and also health quiz coming up where you can win prizes from Apollo 24/7. Also, let me start the show by talking about Sachi, that is Saving a Child's Health Initiative, which is a wonderful initiative from Apollo Foundation and Apollo 24/7. Sachi is free pediatric consults for every child in need in association with Apollo 24/7. Apollo is on a mission to make quality healthcare accessible to underprivileged children at no cost. More than 10 plus pediatric specialties who are renowned Apollo pediatricians are benefiting children across India. To know more about this and to spread the good word, please scan the QR code to know more about this wonderful initiative. Let's start today's discussion. We're talking about cancer treatments. Modern technology has given us more newer age cancer treatments. We'll understand how they're going to help families with who are dealing with cancer. Joining us very shortly is Dr. Shishir Shetty. Let me introduce this wonderful personality to you who's going to answer all the queries in live. Dr. Shishir Shetty is MCH Surgical Oncology, MS General Surgery, who's a lead senior consultant oncologist at Apollo Hospitals Navi Mumbai. He has done approximately 10,000 cancer surgeries, which is a great number, honored by the Odisha government for contribution to healthcare. He is published in major national and international journals. He is specialized in robotic cancer surgery. It's an honor to have such a wonderful expert here with us. Namaste, Dr. Shishir Shetty. Welcome to the show.
Namaste, namaste. Thank you so much for inviting.
Yes, doctor. It's a, you must have seen so much of progress. Cancer treatments from the day that people used to have fear of cancer, fear of death due to cancer, to the age where cancer is not anymore as scary as it was earlier. You must have seen a lot of progress. So, is cancer as deadly as before, or has the medical advancement given some benefit here?
We we have seen the transition from telephone landlines to cell phones today. We
Yes.
have seen that transition. And believe me, in our lifetime, I have seen the transition from life expectancy of 75% to 90%, 98%. So when we have seen so many changes that has come in the evolution of treatment, and we are talking about increasing the lifespan of human beings from 40, 50 to now 80, 90, and still going strong. So I think the
Great.
whole aim is longevity and giving a good quality life to people.
Wonderful. Doctor, I see a glass in the frame. Could we just move? It's distracting your wonderful vision. So, yeah, slightly out. Yeah. Thank you so much, Doctor. So, understanding that we have reached a place where we can extend hope to people who are going through cancer. What are the new age treatments? We've heard about cancer, बोला तो chemotherapy सुना है. We've heard of radiation. We've heard of surgeries. What are the new age treatments, and what are these components, and right from surgery to chemotherapy?
So there was, surgeons have transitioned from big open surgeries to radical surgeries to now we are doing minimal invasive surgery to the present generation high-end robotic surgery. So that is a transition that has happened in surgery. Understanding of what is good, how much is required, doing less is more today. Like at one time,
Yes.
I used to remove the whole breast. I used to remove the muscle at one time. There was a 30 years back, we used to think of talking about these diseases. Today, we talk about oncoplasty, we talk about breast conservation, never ever compromising on the quality of life, on the survival. That is our understanding, and that is what we have done today. And that is what has changed majorly in surgery, that we look into things. We
Right.
are
So,
into an era of immunotherapy. We are
yeah.
into an era of immunotherapy, and I am sure you have a lot of questions on immunotherapy of that.
Of course, yes. But to start with, let me understand what the progressions of surgery have become. As you're talking, you said it's become minimal. Earlier, it used to be scarred. It used to be, they used to take so much of time, and surgery for cancer itself used to be, this recovering from surgery used to be so much more effort. So now the robotic surgery, and I've seen that you've done more than 10,000 plus surgeries. This intrigues me. What kind of help does a robot play here, or what kind of advancement in technology has come into surgeries?
Ropo is an extended version of my hand
Okay,
into the abdomen with all the movements possible inside the abdomen
correct.
with a
Wherever your hand
vision,
cannot reach.
yeah, with a vision that is three-dimensional and up close. That amazing vision, clarity, understanding of the anatomy, and the precision at which I can do the surgery is what has changed the way we do things. One. The second is whenever I do minimal invasive surgery in the chest or in the abdomen, the recovery is very fast. We used to do at one time a huge midline scar or the scar in the there. The pain of the incision was so much that it used to take quite some time to recover. Today we're talking about third day discharge, second day discharge, 48 hours discharge, 24 hours discharge, smaller surgeries. Uh, it's revolutionized the way. The incisions, hernia, all these things are prevented and things are gone. Yeah,
Right.
that's where we
So
are now.
wonderful. So understanding that technology is helping us in a way, but as also has it added any pressure on you performing? लोग तो सोचते होंगे कि अरे रोबोट कर रहा है डॉक्टर क्या करेंगे? Have you heard such kind of statements as well?
I know the importance in general is not given to the man behind the machine. I think the person behind the machine is very, very important. Understanding technology, understanding how it can be used for the best, how the pressures today are extremely great. There is a huge demand of life and expectancy from modern treatment, and everybody wants to get their battered ambassador brand new. You, it's not that easy, is it? So it's a tough job today, especially with the type of tumors and which we do today. Very few doctors do it in the world. Uh, it's very niche. The type of treatment that we offer is is so specialized that sometimes we think that oh my God, the we're just waiting for things to get over and patient to go back home happily. I think that is one of our main concerns that helps.
Yes.
And there is a
When
lot
such
of
a concern,
expectancy
when
from
such a
the
thought is
relatives.
behind treatment, when you have that positive thought of sending a patient back hale and healthy as early as possible, definitely it's going to help. So understanding that the newer age surgery is helping uh, patients recover fast. What role does chemotherapy play now, and how much of chemotherapy is necessary, and have the chemotherapy side effects have changed with the advancement of medical evolution?
So when we were studying, there were only a handful, two, three chemotherapy medicines. Today, we have more than 20, 30 chemotherapies, targeted therapies. And the type and support that is needed for chemotherapy and the recovery is completely different from what it was before. We have specialized nursing, we have chemo ports, so that those ghastly IV lines cannot be taken again and again. Uh, we we talk about a support at home. We talk about giving good blood support. We talk about so many things which helps the patient through their journey when they are taking treatment. Today, when we talk about targeted treatment, it does help the patient because there is a scope where we can prevent normal cells from getting affected. And that is how it is helped
Great. So
patients and also made a job a little easier, I suppose.
It does, it does. So understanding that you were talking about the new age immunotherapy. Who requires immunotherapy and what is immunotherapy? This is something very new that we are hearing now.
So, immunotherapy is not homeopathy, it is not Ayurveda, okay? It is nothing to do with the exercise body. Immunotherapy is basically a type of treatment which will help you, your body, to fight against the cancer cells. It will program your T cells or your defense system to fight against the cancer cells. That way, leading to a better quality life and a longer life.
Okay.
That's how
So
basically immunotherapy works.
so is it something which goes along with the surgery, chemotherapy, radiation, and other things that we've been hearing? Is it a simultaneous kind of treatment or it's a different treatment altogether?
So, immunotherapy is not for early disease. Immunotherapy is given for advanced disease.
Okay. Okay.
Okay. Immunotherapy is used in late diseases where there are very few months of survival, and we can probably offer them years of survival.
Okay. Okay.
So, it is not the first modality of treatment.
Right. So this is not like the general immunity development that we've been hearing all over COVID times ki immunity badao, immunity badao. Is this something related to it or like how Ayurvedic and homeopathic and other alternate medicines claim to say that they improve immunity? Doctor, you're not audible. Can you hear us, doctor? Yeah. I cannot, no, you are not audible. We could not hear you. Well, म्यूट हुआ है बाय मिस्टेक कहीं म्यूट हुआ है ट्राई
No,
स्पीकिंग सम
now I can hear you.
यस दे कैन हियर यू नाउ
Yeah. Yeah. So, building immunity may help you prevent cancers, but it has nothing to do with immunotherapy. It is something very different.
राइट सो दैट्स नॉट द सेम थिंग दैट पीपल माइट थिंक एंड से दैट मेरा इम्यूनिटी बढ़ रहा है तो
No,
ये कैंसर के लिए
no,
थेरेपी है नो so how does this
no.
work is it oral pills or injectables or any gadget
So
led
many of them are oral pills. Some are injectables, but they are easier to take, easier to tolerate, and better quality life. Yes.
that's
And
nice
the cure
so they would
rates, the type of treatment you get is amazing. Yes.
Great. So, understanding that certain cancers are lethal and certain cancers can be treated at a very early stage, what are the new age treatments which are helping certain cancers, doctor?
See, the new age treatment that is helping cancers is good quality surgery, better treatment, great chemotherapy, radiation, especially with the new age radiation. We've got a great treatment in India called Proton in Chennai,
Yes.
which is helping, which is helping many patients, especially pediatric brain tumors and all these people. It's helping them. So things are really changing in our world.
So, Apollo's proton treatment is a kind of radiation which is one of its kind in the country.
So proton, the regular radiation is photon. Okay,
Yeah.
proton is a different treatment. Is a very huge machine, and it delivers something known as pencil beam treatment, where it's like you can paint the tumor, and
Acha.
only that area will get the specific treatment. It There is no follow through. So if you're giving a radiation, it comes from here. It proton is just here. So this is available now. Yes, that is something which is great.
Okay. So here in the entire battle, a lot of treatment modalities and advancements have changed, but the person who is going through cancer, I suppose they go through the entire cycle of fear and anxiety. That has not changed, I suppose. So what is your advice to people who, families or people who are going through cancer? How do you think that they should fight it out, the fear?
The probably one of the most important thing everybody should do is try to understand the disease from learned people. Okay. So it is important that you understand the disease, understand where your family member, your relative, or your friend stands, what is the scope of treatment, so that you can plan things well. And honest advice is important. Sometimes we get a lot of uh, unwanted advice, which is very common in our country. It is something which is important. Once you understand the disease, no patient is looking for sympathy. They need support. They need moral support. They need help. They may need some financial help. They may need uh, a support system. They may need a good center. They may need a lot of things which can be given by your friends and family. And today, when we have so many counselors, I think we are much better placed than what we were 20 years ago.
Correct, correct. So now understanding that it's not just the person who is going through going through cancer, the family also is going through some amount of pressure while giving support. So they also should understand all the treatment modalities and equally understand what the fight is going to be about, right, doctor?
The fear of death is something which paralyzes not only the patient, but everybody who is related and connected emotionally to the patient. And that fear is something which needs to be allayed, which needs to be dealt with. Then only I think we can move ahead and
Correct.
plan things for them. But that fear is the biggest fear that sometimes is our challenge.
Done. While fear of death still exists, and that is a major factor, a lot of people have other problems as well. Especially younger people who are going through cancer. I had my friend who was a professor in TES. She just walked in and walked out, and she went back to office. She had great grit of getting back to office. So working and teaching was a passion. So, how does cancer treatment affect employment, and people have to go through a certain amount of treatment period? What impact does it have?
So the problem that happens is sometimes with extensive chemotherapy, with the radiation, the patient may be put down. Uh, but I feel today many of my patients they go back to work. They uh, you see in India or anywhere in the world, the lady of the house is the most important person. She is
True.
the center around which the family is. So there is a lot of pressure on her to go back to work. Otherwise, everybody is at disarray. So there is a lot of pressure. In workplace, the support that people get is amazing. Today, I think we are much better off when, whenever somebody says, oh, she's got cancer, and then they would say, oh God, she's going to die. No, it's not that anymore. Because of the awareness, we are treating more patients early. And that's where the key is. I think we need to treat patients early. We have to catch the disease early and finish it off once for all.
That's that's a great phrase.
That's
And
the
catching
focus.
it early, screening programs make a lot of difference. Who should understand, and when should one start screening? What is an appropriate program for catching something early?
So if you don't have any family history or genetic history of cancers in your family, the best way to start is by the age of 40, 45, you should get a screening program done. Most of the hospitals have a list of them. And if you Google, I'm sure you'll get a lot of screening programs. In India, breast, cervix cancer are the most common cancers, easier to screen.
Yeah.
Like you do a mammography once in a year, twice a year, once in 2 years after the age of 45 will help you. You do
Yeah.
a simple pap smear once in a year, it will help you. It will detect cancers years before it is formed. You do a simple stool test and try to find whether there is blood in it. Isn't it very simple? These are cheap tests. So I think that is where the whole things like identifying non-communicable diseases like cancer very early and curing them.
Yeah. So with that question, I would want to start the questions on the YouTube chat box. All the audience who have already asked the questions, I'm going to get into your questions as well. Doctor, this is Sandeep Garg who is asking a question which is very, very important for all of us. Can we avoid cancer? What lifestyle should I be adopting to avoid cancer?
Yes. So you think of your body as a temple, okay? You think of your body as a temple. You think of your body as a grand old Mark One ambassador car.
Okay.
You keep your temple clean with pious thoughts. You keep your temple very, very clean with a lot of things. A temple goes through a lot of changes, but there is a certain spiritual element which is attached to your temple. You want to run your old car for many, many years, then what you put into the car is very important. You eat well. You don't abuse your vehicle. Why do you want to abuse your body? So as long as you can drive your old car for a long period of time, I think you got what I'm trying to say.
Yes.
Is you have to be physically fit, you have to be mentally fit, you have to eat well, sleep well, and a sense of balance is what is needed for everything.
So, through good food, do you think that one can take care of them preventing or not getting cancer, which is not genetic or hereditary, of course, but the kind of food that we eat right
Uh,
now, whatever is available is junk, and also so much of fertilizer, pesticide, and so much of chemicals in it. So, do you think that eating organic food would help?
So, food is a very, very touchy topic. Uh, I think that the more you are closer to nature when it comes to food, the better you are,
Right.
right? So, refined food is a problem.
Avoid refined food.
Burnt
Great.
food is a problem.
Burnt food, you said. Like
Yeah,
all of these,
is a
yeah.
problem.
Fried or burnt.
Stored food, stirred food is a problem.
Okay. Burnt, fried, stored.
So
Done.
wherever
So,
there are preservatives, there are problems.
yes. Okay. Doctor, here's the next question from Sauvik Mandal. Sir, what are the symptoms of cancer and what to do in a fourth level cancer? So, are there any symptoms which show up as in other diseases in cancer?
So cancer is a very, very huge term. If you're specific about which type of cancer you're talking about, maybe I can elaborate better. But to get your point, stage 4 cancer is something which is very difficult to treat. But maybe we can try immunotherapy or something else. If you can send in the details, maybe we can look into it and try to find out a way to treat. But you have to understand, stage 4 is not curable. This is something which we have to accept. It is not curable. But we can think of good quality life. Yet, if the medicines work, then we can look at lengthening the span of life. Increasing the span of life with good quality is would be the aim of it.
Okay. The next question is about mouth cancer, doctor. What are the types of mouth cancer? And of course, the reasons that the known devils I would want you to talk about tobacco and its effects as well.
So the biggest cause of mouth cancer is tobacco, tobacco, and tobacco. Okay,
Yeah.
in all forms, whether you chew, you snuff, you smoke, tobacco is one of the biggest killers. And I think if you remove tobacco from your life, our population would increase.
Right.
So
No amount
40,
of film
50%
में
of all
जाते हैं.
cancers are related.
Yeah. Every film now has an anti-tobacco campaign, advertisement campaign going on, which people would want to watch it in a disgust, but wouldn't want to throw tobacco out of their lives.
I think it started in the earlier days when the Marlboro man smoked, and that was seen as a very manly thing to do.
Yeah.
And that initial advertisement years back is still imprinted on people's life. And I think people prefer that macho image or, that
The
bad
cool
boy,
image.
bad girl image. Yeah, the cool image, which is associated. And I think it's high time you get rid of it. So, yeah.
Yes. So, what are the types of mouth cancer? Was Mr. Bharadwaj's question.
So there is only one type of cancer. Mouth means it can affect anywhere in the mouth, whether it is tongue, lips, cheek, mandible, throat, tonsil. So different areas of cancer, or even the larynx. So different types of cancer. It is a stages and depends upon which we give a specific treatment.
So, it starts
So
as a.
today, if it is
Yeah. How does
so
one
today if it
identify
is say
such?
lip,
Huh? Please continue, doctor.
so oral cavity is easy because it's easily accessible. If you have an ulcer which is refusing to heal, if you got a spot which is white and is not going, if something is paining and is not getting treated, if you got difficulty in swallowing food and you are unable to take care of it with regular medicine, it's high time you get a consult with a cancer surgeon or your ENT surgeon who may be able to have a look and probably do a small biopsy to confirm. But if
Okay.
you are a smoker, you should go early.
Done. So smoking or any tobacco thing is a warning, and anything should be immediately attended to. The next question is Arokia Raj. My wife has postmenopausal bleeding with thickness of endometrium 11.6 mm, endometrium curated, and specimen sent for HPE result, which is benign endometrial polyp. My question is, does she need hysterectomy with BSO?
Okay, so the question is if the bleeding continues, there are ways where we can stop the bleeding. Since the biopsy is negative, so the fear is not there, you do not need a surgery. Uh, since she is postmenopausal, whether you remove the ovaries or not does not matter. So generally in a postmenopausal, if you are going for a hysterectomy, then it is always with a BSO. But if she is okay and you are all right, I think you can conserve. But believe me, there is too much of worry sometimes. Uh, and sometimes it's easier to get rid of the uterus than worry about it day and night.
Okay.
But I would prefer if some good surgeon, gynecologist, or a cancer surgeon has a look at the reports and then take an informed call on this.
Okay, doctor. Thank you so much for that answer. And next question is from Mr. Kedar Nandi. My wife was suffering from carcinoma endometrium, now malignant. Uh, no malignancy after operation and external radiation, but there are side effects. After radiation, her intestine has been blocked. She has to gone for operation. Can she avoid surgery? Okay, I hope you got the question. It was in bits and pieces. Wife was suffering from carcinoma endometrium. After
No,
surgery
no, I
and external.
understand what he's trying to
Yes,
say.
yes, doctor.
So, this is a problem that sometimes radiation can have its own side effects, where it can affect the urinary bladder and the rectum, one, or there can be very bad adhesions in the intestines. So that is where the problem occurs, and sometimes you may need surgery to relieve the symptoms, sometimes a stoma. But I think it all depends on the symptoms. If she is bleeding from the rectum continuously, that she needs blood transfusion, or she is in obstruction where she has to get admitted time and again, she may need surgery. We try all sorts of conservative treatment possible. Sometimes we wait for a year, 2 years before we actually intervene because it's not an easy job for a surgeon also.
Yeah.
Okay. Yeah.
There's always a pressure on surgeon here. So yes, that's it,
Yeah.
Kedar Nandiji. You can consult Dr. Shishir Shetty further on Apollo 247 as well to get a personal consultation. Here's Rani Gaur's question. Sometimes TB is also diagnosed as cancer and chemotherapy is suggested. Is that the only way to treat?
No, 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 no. Please do not confuse tuberculosis and cancer. Sometimes I have seen in my OPD where symptoms and signs are that of cancer, but one look at it, I know it is not cancer, it is tuberculosis. And believe me, I have seen a lot of these cases. Because nowadays, even tuberculosis, we call it an atypical presentation that we see nowadays, which is very common. I've seen multiple bone lesions, tubercular bone lesions coming to me for cancer treatment. I've seen huge ascites, that is fluid in the abdomen, coming to me for ovarian cancer. But without a biopsy, you should not give chemotherapy. Chemotherapy is not given for tuberculosis. Tuberculosis has its separate medicines and treatment which can be done, but they are two different things.
Thank you so much for clarity on that. Yes, here's Bharat Prasad Nayak who's asking, what is ledger therapy in cancer treatment and how is it undertaken for whom?
Can you spell it, please?
Ledger therapy, Ledger, ledger, like as in ledger. I have not.
I am so sorry, I am unaware of this treatment.
All right. Yes. Mr. Manish Chaturvedi, thank you so much for giving that positive feedback. He's gone through proton radiation at Chennai last year at Apollo. It was very good and executed well. Thank you again. So, what role does positive attitude and diet have to do with cancer treatment? Manish Chaturvedi,
One
who is
minute. This person must be talking about laser treatment.
okay. Bharat Prasad Naik ji ka question, not ledger. Okay, laser treatment could be a typographical error.
It might be laser treatment. So laser treatment is basically given in early lesions. We can do it for head and neck cancers. We
Okay.
do it for oral cancer. We do it for laryngeal cancers. We sometimes use it for skin cancers. Uh, oh, that's all. That's there. Yeah. So laser is a method of cutting. Like use the knife. Laser is used as a cutting device
Okay.
with minimal problems. Yeah.
Right, done. So, and Mr. Manish Chaturvedi, who had undergone proton treatment at Apollo, is also complimenting and is asking, what role does positive attitude and diet have to do with cancer treatment? Any suggestions on the diet after treatment?
So positive attitude is very important overall in life, right? Overall in life. Especially when you have gone through a treatment which is, uh, where there is a lot of emotion which is attached to the treatment. Uh, you need to be very, very positive in your outlook towards life. And sometimes a lot of lives depend upon you. If you are not positive, then what happens to the people around you? So I
Right,
tell this quite frequently that whether it is relative or patient, inner happiness is what will spread happiness. So be selfish, be happy first, and then you can spread happiness all around you. Uh,
great.
yes, it helps. Eating the
Done.
right kind of food or exercise is important part of living life, and more so with any kind of treatment, whether it is cancer or any type of disease or ailment. So eating right can never be replaced. Sleeping well cannot be replaced. Regular exercise cannot be replaced. Whether it is for prevention or whether it is to recuperate or whether it is to just enjoy life.
Great. Yes, Doctor, a lot of questions which are coming up regarding treatments. Vijay Shekhar has undergone mastectomy in the right breast on 19th November 2021. I have now severe pain in the hand. What is the reason?
So one of the most common problems is when there is a lymphedema of the same hand. That is, there is a swelling of the arm post surgery. This is one of the most common things where there is a swelling and pain in the arm, or it is somewhere in the shoulder. If there is a pain, it is because of mobility thing. But the only treatment is physiotherapy, good exercise. Sometimes, if the arm is swollen, you may need lymphedema treatment in the form of compression dressings. But yes, that is the way we have to do this.
Done. Next question is also about yeah, Sudhir Shukla, again breast cancer के बारे में पूछ रहे हैं. Sir, what's the latest line of treatment for ER positive HER2 breast cancer after the cells have become resistant to ribociclib and letrozole? Sorry if I have not spelled them right.
So you're already taken ribociclib and letrozole combinations. If the disease is still there, uh, maybe we can try something different. But you know what? It would be better if you can send me all the details of what was the first line treatment and second line treatment so that we can offer you an alternative. There are three medicines that we can use. Maybe one of them will work. Uh, I think ER and HER2 both are positive, so maybe we can look into something different. So please
Okay.
send
So,
over the
Mr.
reports. I
Steve
think
Shukla,
that would be better.
can you can consult Dr. Shishir Shetty on Apollo 247, and also Sandeep Garg ji जो पहला question पूछ चुके हैं, he is also wanting to add more information and consult you. Doctor can be consulted on Apollo 247 as well. All right. Next question is about breast cancer in male. One of my friend, this is Bharat Prasad Naik, who's saying one of my friends is who's a male having a breast cancer. What are the reasons of having breast cancer in male?
So breast cancer in male is not that frequent. Nobody really knows why it happens. It is not associated with any of the known risk factors. But somewhere I think hormonal changes has a role to play. Some people have associated with increased estrogen intake in food, milk, or some other treatment. But nobody knows the reason why it happens.
Okay.
Uh, so
Yeah. It's okay, but that's also treatable. I think it's the same kind of treatment modality. अगर आता
yes,
है तो,
yes, it's the same type of treatment. It's
so
the
the
same
here
type
the
of
gender
treatment.
doesn't
There's no
play a
change.
role.
No, no.
Okay. So Vishnu Shankar is asking, is Apollo proton therapy available only in Chennai?
Yes, yes. Proton is not something that can be available everywhere. It was the first center in the whole of South Asia. And yes, it's there only in Chennai at Apollo Proton Center.
Wonderful, doctor. Shafali Tomar is asking this question. I'm suffering from grade 2 breast cancer, 24-year-old. So, what's the reason for cancer in such a young age? And this is increasing, no, doctor?
I know I am treating a lot of young patients nowadays, and we are looking into it. We are looking at genetic mutations which are occurring, and we do not know why it is happening. Really, we do not know. And it's unfortunate that younger people are getting breast cancer, where their life is just started and you're getting this. Uh, But the prognosis, in the sense, life expectancy is the same whether you are younger or older. The only problem which happens in a younger patient is that sometimes the detection rate, or when the patient is diagnosed, it is a little late. So if you have a breast lump, do not ignore your breast lump. Uh, you don't have to visit a cancer surgeon, but maybe your gynecologist who you are comfortable with, or a lady doctor you are comfortable with, can have a look at you and maybe get a biopsy done. So it is important that it is seen. Any lump which is increasing in size should be monitored. That is why, I wish I could run a video on self breast examination. We should try and educate people on self breast examination once a month, 2 weeks after their last date of periods is the time they should get self breast examination done. Whether you're 20, 25, 40, 50, 60, does not matter. Everybody should do it once a month. It is like devoting your time to your body, and you should
Yes.
do it.
Yes, also understand what a normal breast feels like, and agar changes hai on a longer run, you will understand. I started this only after I
And
interviewed my first oncologist long back. How this is self breast assessment is important. So it's become a habit, and one should inculcate this.
we call it become your own doctor because you know your breast the best.
Yes,
You will be the first one to detect the problem
correct, doctor.
if it is there.
Doctor, yeah, this is
And one
next
more
is
thing,
yeah. Please go ahead.
not all breast lumps are cancerous.
Exactly.
Please understand, not all. So 80% or more than 80% are not cancerous. So don't fear if you have a breast lump, but please get it examined.
Spurti is asking, sir, is breast cancer curable?
Yes, stage one, stage two, we talk about cure.
Great. So, Doctor, as I'm running short and there are a lot of questions, quick answers in if possible. Is stage 3 cancer curable, Vishnu Shankar? Which cancer is not mentioned?
Sometimes, sometimes, but most of the time we talk about controlling it for a period of time.
Done. Sayantan Tarafdar is asking this question from Kolkata. My mother had undergone hysterectomy last week. Doctor has done frozen test and looks malignancy, though pap smear is negative, waiting for biopsy. Where can we go for cancer treatment? We are from Kolkata.
Kolkata has an Apollo Center. You can go there. But first confirm that there is cancer.
Done.
You are most
Thank you,
welcome to
Doctor.
come to Bombay, but Apollo Center is there in Kolkata. You can go there.
Okay. Mr. Mohammed Salman ji पूछ रहे हैं for intercarcinal germinoma brain tumor after having tomotherapy radiation, my brother is not able to eat since 3 years. Is proton therapy radiation benefiting after tomotherapy radiation?
So if the tomotherapy is done and if there is no disease, then there is no need of treatment. But if there is a recurrence of the disease, then maybe our proton team can have a look at it and then decide whether it is needed. If it is needed, yes. If it is not needed, why?
Okay.
Symptoms which are associated with a brain tumor may be related to a eating disorder, which can be looked into by specific people. Yeah.
Done. Sandeep Chakrabarti's question is: my father was diagnosed with stage 4 cancer at the base of tongue,
Yeah,
Vallecu,
vallecula.
vallecula last year. He underwent chemotherapy and 33 radiations along with biomab. He has responded well. Is he cancer free now?
So you need to undergo examination. You are on the right modality of treatment where radiation with chemotherapy and also biomap has been given, which will definitely help you. Now you are to be monitored by your surgeon who will have a look down into the throat to see whether there is a disease recurrence or not. We have to monitor you at least for 5 years. If there is
Five
a
years.
recurrence, you may need to undergo surgery. So nobody can say whether you're disease free or not, but the best treatment has been probably given to you.
Wonderful. Next question is Kiran's question. My mother, 59-year-old, has been diagnosed with recurrent GBM. Doctor suggested Karmstein wafers. Is that really beneficial? What are the pros and cons and risks associated with Karmstein wafers? I'm not sure
Oh,
spelt right.
no. Uh, so the only thing that we know about GBM is radiation, then we give medicines, and proton is one of the good methods of treatment. Other than that, I'm not much aware of this because I don't treat brain tumors much. So,
Okay, doctor. Ankur Bharadwaj and Kapil Nizaman, both of them are asking about proton therapy. Can proton beam therapy be done after completion of chemotherapy and radiotherapy? That's one question. And Mr. Kapil's question is: are immunotherapy and proton related treatments available for treating advanced stage 4 prostate cancer?
prostate cancer, only in a specific group of patients we give immunotherapy, not all. You have to do certain tests on the biopsy. That is one. Proton, I'm not sure whether we can give proton in metastatic where everywhere the disease is there. But if there is a localized recurrence, which is maybe we can try proton in a specific area. What is the previous question?
One is after radiation and chemotherapy can be, and the other
Yeah,
one is
yeah.
stage 4
So,
prostate.
so please understand that proton can be given post radiation and chemotherapy if there is a residual disease or if there is a disease that has to be dealt with or there is a recurrence. So I think that is all. We need an evaluation of it, whether this thing. Not proton is not the answer to everything.
Okay. Uma is asking next question. I'm diagnosed with thyroid cancer. Radio iodine therapy is given. Second radiotherapy is planned after 3 months. Do I require to go for a second consultation? Am I on the right treatment protocol?
So generally, radiotherapy is not given for thyroid cancer. It is radioiodine treatment which is given. If
Yeah,
radioiodine treatment is already
radiotherapy.
been given to you, if radioiodine treatment is already given to you, you probably have got a well differentiated or a moderately differentiated thyroid cancer. Thyroid cancers, most of them are curable. So I think you're on the right track.
Okay. Here's Anesha Datta. My mom diagnosed with submandibular gland cancer. She underwent a surgery and successfully removed the tumor. Chemo and radiation are also given as a precaution. Can we prevent the cancer recurrence?
So submandibular cancer, whether it is squamous cell cancer or not, we do not know the subtype of it. I think you just have to continuously, regularly be on a watch, have a healthy diet, drink a lot of water. Uh, that's all that you can do to lead a normal life. But I would say that most of the time you get cured of this disease. So I don't see a problem. Please be on a continuous follow-up with your consultant doctor, and he will be able to help you. Yes.
Right. Jilani Basha Sheikh पूछते हैं any foods that can absorb and remove nitrosamines from our body.
Oh my God, we have a scientist here. Uh, really, there is nothing, no food available which can do that,
Okay.
except
I think we can keep that
limit
for
it
another
intake
discussion
in
day,
food.
doctor.
I know, I know. But
Yeah.
limit yourself to having a healthy diet, not take it in the first place.
Great, great. Also, this is Raj Kishore saying, my daughter's got chemotherapy for BALL last year, completed and under maintenance cycle. How long this cycle has to go and how to keep us safe? Any worrying symptoms to watch out
So,
for?
so usually it is for 2 years, and generally they do well. We got long-term survivors. My very close friend's daughter She's my son's age and she's having a normal life. So I've seen so many survivors. There's so many people working in our hospital. So yeah, ALL is a curable disease. I don't think you have to worry about it. So as long as maintenance is for some time, not forever, unless
Done.
the disease is bad and you are waiting for bone marrow transplant. But otherwise,
Yeah. Okay, doctor, this is Satadal Chaki. I was diagnosed as CA prostate 2.5 years back. Radiation therapy is done. Thereafter, I'm taking leprolide every 3 months for 3 years. I have no complications. What's the future?
you're good. Continue taking letrozole. You will be taking it for 7 years,
Yes, great.
and you
Vishnu
need to
Shankar.
take care of your bone health.
Okay.
You need to take care of your bone health if you're taking letrozole. So, lot of sun exposure, calcium tablets. That is what you'll have to do. Yes.
Done. Here's Sheila Mani, stage 2 esophageal cancer. Is surgery the only option in case we don't want to go for surgery? What are the other options?
You're looking at a curative option. If you want a curative option, then surgery is the best treatment. The second best treatment may be radiation and chemo,
Okay.
but that is second best.
Deepak, done. Deepak is asking this question. Ovarian cyst, approximately 15 centimeters found, 37-year-old female. All other reports good, except for ovarian cyst. Doctor suggests that they have to remove, including ovary. Is this the right treatment? Not all. If that's not malignant,
No, 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 not all ovarian cyst is cancerous. You can do a laparoscopy. As long as the CA125 is normal and there are no solid component in the ovarian cyst, I think you can safely go ahead with the lap surgery. Yeah.
right. So, a lot of questions, but I need to wrap up because it's already time that I'm crossing. But I would want you to give me tips to beat cancer without fear. How do we eliminate cancer? What is the promise that new age cancer treatment gives to people who are suffering with cancer or families who have cancer?
So we have a lot of technology with us. Technology should not rule us. We should be ruling the technology. We should, as doctors, it's our responsibility to use the best technology for treatment of cancer. And we make it a point that we do that. Living a simple, healthy life is probably will go a long way to control this non-communicable disease like cancer. We talk about healthy life, healthy lifestyle. We talk about eating well, sleeping well, take care of your body like your temple, take care as you would normally do. Uh, is what I would suggest that we do. Uh, Not much that I can tell you because I think it's like all the priests, all the sadhus who are preaching, all the cult gurus who are preaching. Everybody knows what is to be done. At the same time, there is a denial. Okay, let me do this. A drink won't have a problem. This won't is not a problem, and they go into doing things which are unhealthy. So I think the only way is to live a healthy lifestyle, and that is what you have to
Yeah.
do. Thank you.
Done. Thank you so much, Doctor. Doctor, before I take leave, I just spotted one more question which I thought we could give an answer to. Shobna is asking this question. Father, 62-year-old, diagnosed with rectum cancer, chemo radiation therapy completed, tumor is 7.6 mm, length is 5 and anal verge 5 centimeters, sphincter are free. LAR or APR, what do you suggest?
LAR, robotic LAR.
And we have one of the best robotic surgeon here with us today. Thank you so much, doctor. And as you were mentioning that
Thank you, Jansi.
yeah. As you were mentioning, self breast examination is very important and one should understand how to do. And you were wanting to do a video on it. We'll get back to you on that. But for the awareness, we have posted a link in the chat box which leads to self breast awareness examination video. So the link is given below in the chat box. Thank you so much, Dr. Shishir Shetty. It was a great session, very positive session today we had. Thank you for your time. Namaskar.
Thank you for spending a Sunday morning with me. Thank you
Thank you,
so
doctor.
much.
Yes, and now we head to our health quiz. I'm going to ask you three questions. Please answer these questions over YouTube chat only. I will be announcing the winner's name towards the end of the show. Winners will be selected at the sole discretion of Team Apollo 24/7. And once you're declared as a winner, you need to write back to us at marketing at apollo247.com. Gift vouchers will be shared. All right, here are the three questions. Today's health quiz question number one is: what is the scientific name of blood cancer? What is the scientific name of blood cancer? Question number two: when is World Cancer Day celebrated? Repeat करती हूँ. Question number two: when is the World Cancer Day celebrated? And question number three: where can you find the repository of health related content on Apollo 24/7 app? Where can you find the repository of health related content on Apollo 24/7 app? Spelling mistake आए तो भी ठीक है. Type कर दीजिए answer and wait for the results. Meanwhile, while we are looking at our winners, let me give you wonderful offers on Apollo 24/7. This week's good offer that we're giving you is doctor consultations direct from Apollo at 150 rupees off मिलता है on first online consultation. Use the code FIRSTVC. You get up to 150 rupees off on first online consultation. The code that you need to use is FIRSTVC. Use the code on Apollo 24/7 and visit a doctor online. And the other coupon that we are giving away today is: use the code FIRST3, order medicines direct from Apollo, get 25% off on online medicine orders. So the code that you got to use is FIRST3. घर बैठे आप अपोलो 24/7 से मेडिसिन ऑर्डर कर सकते हो and also get good discounts. Here, if you use first three, you get 25% off. And I'm waiting for our winners' names. In the meanwhile, you can use these codes HH247 to get up to 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders if you order from Apollo 247. Well, you need to download Apollo 247 first, 24/7 app jo hai, and then also having a circle app will benefit you. It's literally having the entire Apollo hospital in your app hands, and it's so simple to use. I've been using Apollo 24/7 almost the last 1.5 2 years. I've been using great benefits. Go ahead and download the app. While I'm waiting for the winners, we shall also talk about next week's topic. Next week, we are going to talk about liver, taking care of our liver, which is very important because this is one organ which is regenerative as well. Tune into Apollo Health Hour next week, that is 17th April 2022, 11 a.m. We are going to bring you an expert where you can ask all the questions about liver and we shall bring you the answers. And today's session, thank you so much, all of you, for sharing your details and your questions about new age cancer treatments. And Dr. Shishir Shetty was amazing, and he had very patiently had explained all the new age treatments. Here are our winners. I've been waiting for our winners. Sayantan Tarafdar, Jagjit Kaur, Sheila Mani. Congratulations. You're the winners for this week. Please write back to us and claim your gift vouchers. Thank you all for joining us today. Next week, we shall see you soon. And please subscribe Apollo 24/7 YouTube channel. Namaskar.